Reproductive system. Gross anatomy. Reproductive system appears to slumber until puberty. Gonads, primary sex organs. Testes in men. Ovaries in woman. Male reproductive system. Spermatic cord. Blood vessels. And nerves. Seminiferous. Tubule. Ductus, vas. Deferens. Lobule. Septum. Tunica. Albuginea. Epididymis, testes, primary reproductive organ. Seminiferous tubules, sperm-forming factories. Testosterone is produced by interstitial cells that surround the seminiferous tubules. Sperm-producing and hormone-producing functions of the testes are carried out in completely different cells. Viable sperm cannot be produced at normal body temperature. Requires approximately 3 degrees lower. If the temp is too cold, scrotum pulls the testes closer to the body. A series of ducts, epididymes, move the immature sperm. A storage site for sperm. A trip that takes approximately 20 days. As they move along, they gain the ability to swim. During ejaculation, sperm is pushed from the storage site to the vas deferens. Ureter. Urinary bladder. Seminal vesicle. Prostatic urethra. Pubis. Membranous urethra. Ejaculatory duct. Urogenital diaphragm. Rectum. Erectile tissue. Of the penis. Prostate. Bulbourethral gland. Spongy urethra. Shaft of the penis. Ductus, vas, deferens. Epididymis. Glands penis. Testis. Prepuce. A. Scrotum. External urethral orifice. Accessory glands and semen. Urethra carries both urine and sperm, but not at the same time. Seminal vesicles produce about 60% of seminal fluid, feed and activate the sperm. Prostate secretes a milky fluid that plays a role in activating sperm. Semen mixture of sperm and accessory gland secretions. Liquid portion acts as a transport medium for nutrients and chemicals that protect sperm. During ejaculation, 2 to 5 milliliters of semen is produced, containing 50 to 150 million sperm in each milliliter. External genitalia. The penis is designed to deliver sperm into the female reproductive tract. It consists of a shaft made up of erectile tissue, a glans penis and a prepuce, foreskin. Female reproductive system. The reproductive role of the female is much more complex than a male. Ovaries are the primary reproductive organ. Like the testes, they produce both the gamete, egg, and the hormones, estrogen and progesterone. Other organs serve to transport, nurture or serve the needs of reproductive cells/developing fetus. Growing follicles. Primary follicle. Degenerating. Corpus luteum. Blood. Vessels. Mature vesicular. Graafian, follicle. Germinal. Epithelium. Corpus luteum. Developing. Corpus luteum. Ruptured. Follicle. Ovulation. Secondary oocyte, suspensory. Ligament of ovary. Uterine, fallopian, tube. Ovarian. Blood. Vessels. Fundus. Of uterus. Lumen, cavity. Of uterus. Ovary. Broad. Ligament. Infundibulum. Uterine. Tube. Fimbriae. Ovarian ligament. Round ligament of uterus. Body of uterus. Endometrium. Myometrium. Wall of uterus. Perimetrium. Ureter. Uterine blood. Vessels. Cervical canal. Uterosacral. Ligament. Vagina. Cervix. B. Duct system. Fallopian tubes. Uterine tubes receive the ovulated oocyte and provide a site where fertilization can occur. Unlike the male duct system, no contact between uterine tubes and ovaries. Distal end of each tube expands in a funnel-shaped infundibulum that has finger-like projections, fimbriae. These waving fimbriae create currents that carry the oocyte into the tube, not always successful. Uterus functions to receive, retain and nourish a fertilized egg. Major portion of the uterus is referred to as the body. Superior rounded region above entrance to uterine tubes is the fundus. Narrow opening to vagina is the cervix. The wall of the uterus is thick and composed of 3 layers. Endometrium, where implantation occurs. If not implantation doesn't occur, layer is sloughed off, menstruation, in response to changes in hormone levels in the body. Myometrium, composed of smooth muscle that plays an active role in delivery of a baby, where contractions are produced. Suspensory ligament. Of ovary, part of broad ligament. Infundibulum. Uterine tube. Ovary. Fimbriae. Uterus, fundus. Uterosacral. Ligament. Round ligament. Urinary bladder. Pubic symphysis. Rectum. Mons pubis. Cervix. Urethra. Vagina. Clitoris. Anus. Hymen. Labium minus. Greater vestibular gland. Labium majus. A.